clinical vignettes focused on Nocardia, each with 5 answer choices and detailed explanations, including why the incorrect options are wrong. Question 1. Clinical presentation in immunocompromised host. A 55-year-old man undergoing chemotherapy for lymphoma presents with fever, productive cough, and weight loss. Chest CT reveals cavitary lesions in the upper lobes. Acid-fast staining of a bronchoalveolar lodge sample reveals weakly acid-fast branching beaded gram-positive rods. Tuberculin skin test PPD is negative. What is the most likely organism? A. Mycobacterium tuberculosis. B. Nocardia asteroides. C. Actinomyces israelii. D. Histoplasma capsulatum. E. Aspergillus fumigatus. Answer B. Nocardia asteroides. Explanation. Nocardia is a weakly acid-fast aerobic branching filamentous gram-positive rod that causes pulmonary infections, mimicking TB, in immunocompromised patients with a negative PPD. A. M. tuberculosis is strongly acid-fast and would produce a positive PPD. C. Actinomyces is anaerobic, non-acid-fast, and typically causes cervicofacial infections after dental procedures. D. Histoplasma is a dimorphic fungus and typically seen in endemic areas. Intracellular yeast on histology. E. Aspergillus forms septate hypha, not acid-fast, and does not present with beaded branching rods. Question 2. CNS manifestation. A 40-year-old HIV-positive man presents with new-onset seizures. MRI of the brain reveals a ring-enhancing lesion. Biopsy shows filamentous gram-positive rods that are weakly acid-fast. What is the most likely pathogen? A. Toxoplasma gondii. B. Actinomyces israelii. C. Nocardia species. D. Cryptococcus neoformans E. Listeria monocytogenes. Correct answer, C. Nocardia species. Explanation. Nocardia can cause brain abscesses in immunocompromised patients and is recognized by weakly acid-fast branching gram-positive rods on stain. A. Toxoplasma causes multiple ring-enhancing lesions, not branching rods on biopsy. B. Actinomyces is not acid-fast and is more common in oral facial infections. D. Cryptococcus causes meningitis, not abscesses, and is seen with India ink. Listeria can cause meningitis, especially in neonates and elderly, but does not form filamentous rods. Question 3. Treatment choice. A 47-year-old kidney transplant recipient develops fever and dyspnea. CT chest shows a nodular lesion with cavitation. Bronchial wash cultures show weakly acid-fast, gram-positive branching rods. What is the best initial treatment? A. Metronidazole B. Ceftriaxone C. Amphotericin B. D. Trimethoprim sulfamethoxazole. E. Azithromycin. Correct answer D. Trimethoprim sulfamethoxazole. Explanation. The first-line treatment for nocardia infections is TMP-SMX, which covers both pulmonary and CNS involvement. Metronidazole is for anaerobes and protozoa, not nocardia. B. Ceftriaxone is used for many bacterial infections, but not effective against nocardia. C. Amphotericin B is antifungal, not used for bacterial pathogens. Azithromycin is used for atypical bacteria, but not for nocardia. Question 4. Environmental source and features. Which of the following best describes a key characteristic of Nocardia species? A. Anaerobic, urease positive, found in human flora. B. Non-acid-fast, forms sulfur granules. C. Aerobic, catalase positive, weakly acid-fast rod found in soil. D. Anaerobic, spore-forming, club-shaped rod E. Facultative intracellular diplococcus that grows in cold environments. Correct answer C. Aerobic, catalase positive, weakly acid-fast rod found in soil. Explanation. Nocardia is aerobic, catalase positive, weakly acid-fast, and soil-dwelling. It causes opportunistic infections, especially in immunocompromised hosts. A. Describes Proteus, not Nocardia. B. Describes actinomyces, which forms sulfur granules and is non-acid-fast. No Nocardia species is anaerobic or spore-forming. E. Describes Listeria, not Nocardia. Would you like